guys, my name is Gorup, and today is March the 20th, 2015, and I'm going to demonstrate a Lifeport access with a sterile dressing change. So I'll start off with confirming my order and gathering my supplies. Next, I'll go into the patient's room, explain them the procedure, let them know who I am and that this will be sterile. So first off, I'm going to wash my hands, put on my clean gloves, and I'm going to take off the old dressing. When I take off the old dressing, I'm looking for drainage, either on the dressing or on the site. I'm going to assess around it. I'm looking for any redness, edema, or pain. As long as we're good, we can continue. So I'll toss my gloves, wash my hands. Alright, and next we're going to open our sterile field and get our masks out. Since this is a sterile procedure, we don't want the patient to be breathing on it, or me breathing on it. Okay, so using a pinch method, we're going to take our mask out. If they can tolerate it, we'll put the mask on them. If not, we'll just turn their head. Hopefully we can do both. We're going to pretend today that we can. And he's got his head turned. Alright, I forgot my patient identifiers, name and birth date on their armband, just clarifying. Okay, pinch method, my mask. Okay. Alright, so next I'm going to drop all my supplies into my sterile field, and we're going to be sure that we don't break sterility. So, go, here's our bio patch. There it goes. Toss that in our bio bag. Right, here's our syringe, our needle. Huber needle. And our 10 cc syringe. Okay, and now we're going to clean the top of our normal saline with alcohol. Grab it by the corner here. Okay, just place that on top. And we're going to scrub that down for 15 seconds on our watch. We're not going to guess. We're going to actually count 15 seconds. Okay. Now we're just going to let that dry. Next, we're going to put on our sterile gloves. Okay. Pinch the cuff, dominant hand first. Okay. And commit that side of the cuff there to contamination just in case I touch something. Okay. Now here's sterile, so I'm just going to toss this to the side. Alright, and now we're going to clean the patient with their Lifeport site. We're going to pop our wings. Okay, and we're going to clean all the way below the nipple, all the way up past our clavicle here. We're just going back and forth using friction, 60 to 90 seconds on our watch. Alright, we're going to allow that to dry. Next, we're going to prime our Huber needle. So first, we need our saline. We've got our syringe. Here's our cap. I guess we need that. And our needle. We are going to hold on to this cap because we may need it here in a minute. Drop that back in. Alright, so we're drawing up 10 cc's of air. Just right down in there. Push our air in. Alright, and now we're going to flip it back up. Draw our saline out. I'm going to draw a little bit past the 10 just so I have room to push that air out. Okay, and using our cap now, flip it back over, pull it out. Okay, and scoop method. There we go. And I'm going to put this back in my sterile field so I don't lose it anywhere, and I'll remember to put it in the sharps box. Okay, and now we're ready for our Huber needle. Take our cap off. Okay. Be sure that we maintain control of it. All right, now we're going to prime it. We're going to unclamp it. And okay, yeah, remove our sheath. All right, let's make sure we got all of our air out. All right, right there at 10, perfect. I'm gonna clamp that back. I'm going to get ready to access our site now. We need our biohazard patch, blue side up. Going to find our Lifeport again. Once I've found it, I'm going to come in at a 90-degree angle. I'm going to make sure I've pushed that all the way into that chamber there. Alright, slide our little bio patch underneath. Sure it's in there good and tight so it doesn't come off. Push our wings back down. Okay. Now we need to aspirate for blood return. So we're going to unclamp, aspirate. We've got blood return, no clots or anything. So now we're going to flush our 10 cc's with the push-pause method. All 10 cc's of that normal saline. Once we've got that, we can clamp this back. Up here. Okay, so it's out of the way. And now we need our dressing. Okay. That aside. And I just touched the table there, but we won't use this then. Okay, on the top part of my hand. So okay, committing those 3 fingers to contamination. Lay this aside. Be sure we seal all 4 edges. Once we've got that good and sealed, and let this go. We're all sterile here now. Take our paper off. All right, and now we need to label. So we're going to label our initials, our date and time, and we'll just peel this off. And when we put it on here, we want to make sure that we're not hiding the site with it in any way. So be sure we put it good and on the side, but just make sure we can still see it. Alright, and now we're ready to document. So we're done with those sterile gloves. We're going to document how well the patient tolerated it. We're also going to document before and after assessment, any redness, edema, drainage, pain, anything like that, signs of infection. And we're going to be sure that we note how much saline we used to flush, that we used a 10 milliliter cc syringe, that we accessed Lifeport with a Huber needle per doctor's orders, and that's about it. So when we're ready to come back and change our dressing, we're just going to do it all pretty much the same. We're going to come back with clean gloves, take the old one off, assess again, all the same stuff, put the new dressing on with sterile technique, and document and label it just as we did. And that's it. Thanks for watching.